Hello, good afternoon, everyone. Yes, so this is Sangeeta from City International Academy, and welcome to yet another OET live class. I know you've had wonderful sessions, and we've been trying to give for the last 2 weeks. We've been trying to give you live sessions, and the kind of audience that we've got is wonderful because the response is enormous, and that is what is really inspiring us to do more videos. And we are so happy to know that we are able to help many students out there, quite a few who are stranded because they are not able to attend regular sessions. We also at MedCity offer you online classes, okay, and at the same time we also have our free app available for all of you. And those of you who are watching, I suppose you've downloaded our MedCity app and you've started your practice, because we've been mentioning that right from our first live sessions. And if you've used that, you would have had access to a lot of different questions, practice materials, video lessons. Hi, so many of you saying good to see you back. Yes, we have wonderful teachers with us, which is why we rotate. We have sessions by different teachers so that you have access to different perspectives and different methods of delivering lessons. So even though we are all stranded at different locations at our homes, MedCity wants to make sure that you have access to quality sessions. Okay, and in this modern age where all of us have a smartphone at hand and a good internet connection, why not use those facilities to learn? And that is what exactly MedCity also stands for. Hi guys, so like you saw the poster, last week also you've had OET live sessions, and each day was a different module that was wonderfully held by Lintu, one of our trainers, OET trainers, and I know you guys have thoroughly enjoyed her sessions and you've also gained a lot of information, right? So today's session is all about speaking, okay, OET speaking. And if you have questions to ask me, queries about speaking, this is a session where you can shoot out the questions to me. So what I have planned, when I wait for the comments from all of you so that I can respond based on that, I also have with me a set of queries that we've been having or we've been getting whenever we post an OET mock speaking session, or whenever we post some video connected to speaking on our YouTube or Facebook channels. These are the kind of queries that have come up. We have tried our level best to answer most of it then and there, but yes, so that it benefits many of you, and there is no harm in refreshing and revising things we've learned now and again. Hi, so I have those some of the queries in comments, some clarifications required on my phone. We've made a list of it, and I will be talking about that because those are all handpicked about OET speaking itself, and as questions come up on the screen, I'll make sure I answer all of them as well. So it's good to see so many of you watching when it is quite a sunny afternoon. It's quite sunny actually here. Okay, let's begin with that. So right now for me it's sunny in between, and at times it's quite cloudy as well. So there is a good scope for heavy rain, and I hope it rains really heavily so that the climate becomes really good. So how is the climate at the weather at your end? How is it, guys? Is it pleasant? Is it raining? Is it hot? Is it sultry? I'd love to know how it is that you guys are feeling right now before we move on to our sessions. See, when you practice for your OET speaking, it's not only about practicing and trying out different role plays. It's also about bettering your language skill, and that can be done by speaking about any topic that you're interested in. Okay, so it could be about the weather, it could be about food, it could be about sports, it could be just about this lockdown. So whatever you speak, if you try and use English to communicate. Yeah, so Judy says it's hot in Chennai. Yeah, I suppose Chennai is quite known for its real hot climate, and it must be really bad out there. Okay, so Simi Joshi has said it's sunny, cloudy. Okay, so Geetu, very similar to my area. Even your area is quite cloudy. Hot. Okay, Steffi, is it really hot and sunny? I know when we have these afternoon sessions, it's good to know that Vinita says her climate around there is quite pleasant. Any lucky souls experiencing rain right now? Cloudy. So for most of us it's cloudy, and another half it is sunny. For some it is pleasant, but I don't see any. Oh, somebody has wind. So somebody is in Wayanad and it's cloudy. So Gino from Wayanad, it's quite cloudy. Any lucky soul out there experiencing the rains right now? Okay, Bangalore is also sunny. Wow. Okay. So Varun says it's cool. Which part of the world are you from, Varun, that you have a very cool climate? So great to know how you guys are doing. So let's get started with our session. Okay. So those of you who have just joined now, let me just make it clear that this session is to clear any queries that you have regarding OET speaking. Cloudy in Tiruvalla. Good. So I hope you're enjoying the session. I know it's quite cloudy outside. Probably it's humid like how I feel right now. Wow, so Anu says heavy rain. So there's one lucky soul out there. Anu, Matthew, you must be enjoying the rains right now when you're watching this video as well. Nice. Okay. Drizzling. Jacob John, wow. That must be exciting because you're going to have rains ahead. Good. See, things like these, hot and humid. See the kind of words you guys have been using when you're talking about climate. So everybody expresses their understanding of the climate or the weather around them in different ways. So it's good to pick up vocabulary on daily basis while having conversations on anything general like this. So do not think that, okay, that's not going to help in my OET speaking. You may never know, it might come handy, someday or the other when you use it in your speaking. Yeah, so please do not have your mind fixed that I should only enact and practice my role cards to do well in OET speaking. OET speaking is after all a language test, and to better in that there is no other way than to just have conversations in English. Casual conversations, anything you want to talk about to your friends. If you're lucky enough to have a large audience, you can have discussions regarding different topics so that you become more confident. And that, my dear friends, is what is lacking in many of the students. Confidence. Because when you feel that you don't have a lot of words in hand, when you feel that you might make a lot of grammatical errors, when you feel that you're really tensed about taking exams, then you show lack of confidence. And that itself could be a hindrance for you to perform well in your OET speaking. So to be confident, you should feel comfortable when you're using the language. And what better way to feel comfortable than use it very often and as much as possible. Okay, so Nalini says the audio is not clear. So anyone else who has a problem with the audio, I'm trying my best to, be loud enough. I've always been known, for speaking, for having a very low audio when I speak. Okay, so Judy Shima has asked in OET Speaking. So here comes our first question. So Judy Shima has asked, can we use posh language when speaking? I guess, Judy, your question is, instead of posh, probably you're trying to say, can we use big, difficult sounding words? Is that what you mean, Judy? Okay, Royal Ashok, what if we imitate native speakers? Okay, so good questions coming up. Okay, guys, let's answer those questions. So, like Ashok asked, do we have to imitate native English speakers? Should we imitate them? Should we have an accent when we speak in OET? Is accent important? Should we sound like a Britisher or probably an American or an Australian when we speak? Okay. Okay, Danya says about terminally ill patient. Yes, Danya, I'll come to that. So my first question today that we're discussing is, should we have an accent? Well, I would always say, yeah, so Deepa says no need of an accent. Okay, Suji Paul says we should use simple language. Okay, so let me put it this way. I would always say you should have a very neutral accent. So what do I mean by neutral accent? Well, okay, let's say if there are some of you who already have a kind of British accent or Australian accent while you speak, that's fine. You can go ahead, okay? That is not a problem at all. But for those of us, like you and me, who do not have an accent, we should be neutral as much as possible. By neutral, what I mean is, when you speak, it'll be good if the person listening to you is not able to guess which part of the world you are from. Or let's bring it, at a shorter range and say which part of India you're from. Which means you need to avoid mother tongue influence as much as possible in your spoken English. Okay, so when you become quite neutral, that means you are pronouncing most of the words correctly, you are giving the right stress wherever required. I hope you're all aware of word stress, sentence stress. So these interesting factors, if corrected, if pronunciation is corrected, and if you can sound really confident, and if the person listening to you can clearly understand what you're trying to communicate, okay, then you have a neutral accent. And by listening to you, they shouldn't be saying, oh, I suppose you're from Kerala. Oh, I think you're from Mumbai. The way you speak, it's really clear that you're from Mumbai. So that is when you have a little of your mother tongue influence in your English. So if you can try and reduce it, all the better. Okay, but for those of you who feel it might be a big challenge and you're not ready to make that big difference to your accent, as in making it neutral, it's fine. Do not be much bothered about that, because if you're using good language, it should be fine. Okay, so that was our first question about accent. So somebody, I think Ashok has asked about, should we sound like native English speakers? So this is my answer to you. And Judy's question, should we use posh language, that is difficult sounding words? So somebody had commented saying, no, we should use simple language. Well, that's what most people prefer when you speak, to sound simple. Not everyone can really sound, well learned and like a walking and a talking dictionary. So we might use very common words most of the time. But nevertheless, it's always good to build on your vocabulary, and that does not mean you're using difficult, big words. Okay? It's quite interesting if you watched certain videos of, let's say, one of our most prominent political personalities of our country, Shashi Tharoor. So if you've watched or if you've heard the way he speaks, from the way he speaks itself, we know he's very learned. He has been reading lots and lots and lots, right? So, to a great extent, the kind of words you use, the language you use, the kind of sentences you construct, that talks a lot about your personality as well. So a person like Shashi Tharoor, we know he's quite learned. He has read a lot, he's widely read, he knows a lot of stuff. So that's the kind of words he uses. So not every one of us can sound like him, but that does not mean we shouldn't build on a vocabulary. So the kind of words you use completely depends on the audience. So whom are you talking to when it comes to OET speaking? If you're talking to the bystander or the relative of a patient, let's say a mother of a child, you would have to explain a lot of things, and that should be done in real simple language. Okay? So we should sound as simple as possible, because if we use a lot of medical terms there, we might scare the mother. Okay? So here we need to be careful not to use very difficult sounding words. So keep it simple. But probably if you're talking to another colleague of yours, you can use medical language because they will easily understand and you're all used to it. But when it comes to OET speaking, we are most of the time dealing with a patient or a bystander. Correct? So we cannot expect our patients to be extremely good at the language and medically aware of things happening around them, which is why we use the term layman language. So layman meaning a language that common person can understand, like you and me can understand, and I need not have a medical background. Yes, IP George has a sophisticated language. Well, that is really not required. Good. Robin says if you can use language confidently without imitating anyone, that's the best thing. And that's right, exactly, Robin. So I hope I've cleared the question about the kind of words. Judy, I hope it's clear. You don't have to use very high sounding words, but definitely it depends on the audience, the person you are speaking to, and accordingly you will have to blend your language, you will have to make changes to the language you use. Okay, so we had a question regarding how to deal with a terminally ill patient. Now what do you mean by a terminally ill patient? A terminally ill patient is somebody who is really sick, whose condition is really bad and might deteriorate any moment. We are not really sure if he will survive. Okay, we know that he is at high risk. It could be somebody waiting for an organ donor, like a kidney. Now we know the chances of getting another kidney might be very slim, but we shouldn't be losing hope till the last moment. Okay, so when you talk to a terminally ill patient who we know is suffering, who will be highly depressed, who is already aware that probably I will not live longer, you have to be really careful in the language you use, because you have to show that there is hope all the time. Avoid the use of negative words. Never go to that patient and say, I know you will die soon. No, I know none of us will say that. Or I know we cannot say, I know your condition is very bad or you're really sick, but that does not mean you have to be depressed. So we should try and be as much as positive as possible so that we can raise the spirits of that patient, as well as give a lot of confidence and positive vibe to the patient. So we need to avoid negative sounding words. And we need to also be at the same time realistic. We cannot say, I'm sure you live 100 years. That might sound very rude because the patient is well aware of his condition. And it might sound like you are making fun of that patient. So do not have, highly optimistic phrases or sentences. We need to be realistic at the same time. Right, so terminally ill patient, one of the comments says somebody who do not have a lot of other options for treatment. So we have a card in OET which says you're talking to a terminally ill patient who is at the end stage renal disease. So he is a person who's waiting for a donor. He hasn't got a donor yet. He is also nominated himself for not for resuscitation, NFR. So when you are talking to a patient who has opted for NFR, not for resuscitation, or who has signed up for a kidney donor but haven't received any information so far, we need to be hopeful when we talk to the patient, right? So how do you sound hopeful? Maybe the patient says, see, I've been lying in this hospital bed for 2 months now and I've not got a donor. So why would I think I'll get a donor again? So as a nurse, you can, like I said, be very positive about the condition. So you can say, I understand how you feel, but see, Mr. John, if that's his name, I've seen very similar cases in my career so far with all positive outcomes. There have been patients who've been waiting for quite some time but have always managed to get a donor. So I would really ask you not to lose hope, because that will really keep us moving forward. And I'm sure we will find a donor soon, and we're doing all that we can to ensure that you get a donor. So you're positive there, right? So that will definitely, so when you're giving an example saying, you're connecting it to your experience. I have seen similar cases in my career so far. And you're giving a very particular instance where you say, there was a patient who waited for, you can say, some time and got the donor at the last moment, and he still survives. He's doing really well. So do not lose hope, Mr. John. It's just a matter of a short period or a short while, and I'm sure we'll be able to trace a good donor. Okay, so that is one way where you can sound very hopeful. And if the patient says, fine, let us hope that I get the donor, but anyway, I want to sign up for NFR, not for resuscitation. So can you ask the patient, no, please do not do that. Mr. John, don't sign up for NFR. Mr. John, why are you being so negative? NFR and all, but why? I mean, you have such good family with you. There are people, supporting you. Why are you signing up for NFR? So do not question the patient's decisions. Okay? Incorporate, understand the patient's perspective. He might have a reason for signing up for NFR. Maybe he doesn't want to be a burden to his family anymore. Maybe his family, his children, have already supported him for so long and he feels he's a burden. But again, we cannot say, fine, let's go ahead for the NFR. That makes things easy for all of us. No. We need to be careful there. So how do we talk to such a patient who says, I want to sign up for NFR? Respect their decision. Okay? So you say, yes, I understand that you have your reasons for signing up for NFR, but if you give me an opportunity, can I arrange a meeting with one of our counselors? He's a great man and he's helped a lot of patients out here. Probably if you have a discussion with him, you'll feel much better about your decision. Okay? So here I'm trying to persuade him to first have a conversation with a counselor who might be able to change his mind, and he might not, really ask for an NFR. So that is how you can convince him or persuade him. You cannot force him saying, fine, I will arrange a meeting with a counselor. You have to talk to him. You can say, you might feel better, or he's a wonderful man. He's helped so many patients. Why don't you just have a chat with him, just to talk? Probably it will help you make better decisions, or probably it will help you make a decision soon. I'm sure he'll support you. I'm sure he'll help you out much better. So these kind of very positive reinforcements will be highly helpful for a terminally ill patient. So I hope that I've answered that question regarding how to deal a terminally ill patient. Be very careful with the language you use, because it's a patient who is there on his deathbed and probably may not survive. But as medical practitioners, you should never lose hope or never stop trying until the last moment. So as you try, also if the patient is positive and ready, will he be able to get better? So we need to ensure the positive mindset of the patient as well. Okay, so that's your answer to dealing with a terminally ill patient. Any more questions? I think I did find some other questions which just slipped my mind right now. Let me try and trace them. I hope I can find it. So good to see all of you watching. We'll soon have a demo role play as well. Okay, so you guys need to tell, okay, we need to respect the patient's opinion. Yes, that's right, Gigi. We need to make sure we respect their opinion. Okay, thought-provoking. Thanks for the wonderful comments. Okay, yes, so great comments coming up. All right, so the next question, I suppose, was how do you deal with a patient who is really agitated, who's really angry? So you have somebody here who's very angry at what's happening. Probably it's a patient who's been waiting for a long time to meet the doctor. Maybe it's the mother of a child who has some breathing difficulties, and the mother has been waiting for almost an hour and the doctor is not yet here to meet the child. The mother has every right to be angry, right? And imagine dealing with an angry, agitated, difficult patient. That's going to be a lot more challenging. Because when you're really angry, you're not in the right frame of mind to think or make decisions. And that's exactly how the patients behave. Okay? So they get really angry, they start shouting. They might ask you to get out. And that is exactly one of the comments, I've seen, like I said, we've handpicked comments from the videos that we've done before, a few months or a few years before. So we've handpicked a lot of queries there, which will help you, I guess. So one such question is this: what if the patient says, I don't want to talk to you. Can you bring your senior? I want to talk to your doctor. Okay. So, say, I'm not ready to talk to you. I want to talk to your senior. Please, I want to meet the doctor. I've been waiting for an hour. So how do you deal with such a patient who's been waiting, who's not been answered, and who's really agitated at the same time? Now here, the rule is to be really clear with what the situation is. Don't try to cover up. Don't try to find excuses. Give the exact reason. The patient has every right, or the bystander has every right to know the reason for the delay in consultation. Give a genuine reason. Say what is going wrong, and at the same time, tell them what is being done when the patient is waiting for the doctor. Is the patient's health at risk? Okay. So if it's a mother who's been waiting, or sometimes it could be the daughter of a patient. Now the patient was supposed to undergo an operation, so the patient has not had food since morning, and he is a blood pressure patient or a sugar patient, and he's been starving since morning. He was the second on list for the operation and haven't been called yet. The patient has been waiting for 1 hour. Now the daughter will be really angry. So you need to give the reason what is causing the delay. So you could say, I understand that you were second on the list, but the patient prior to you had some complications and the doctor is dealing with it. It will take 15 more minutes. Or it will take 10 minutes more for the procedure to be completed, and another 10 minutes to ensure that the operation theatre is clean and ready for the next patient. Okay, So you're trying to tell the patient or the bystander how long it will take. So 10 minutes for the operation, another 10 minutes for the operation theatre to be ready for the next operation, 20 minutes, probably half an hour, right? So you're giving the real reason, so the patient is aware. And if they are angry, listen to the patient. Why are they angry? Don't try to cut them short. Okay, so let them say, see, my father hasn't had food since morning. Okay, let them, yeah, empathy, that's the right word. Be empathetic towards them. Okay, and also say how the daughter's father is being monitored, and the nurses are all aware of the health condition of the patient, and they are closely monitoring him, and he is doing fine so far. And if he feels he's really hungry or thirsty, probably he can have a small sip of water, probably just wetting his lips, but not drinking large gulps of water. Okay, and you try to tell the patient how important it is to ensure that the operation theatre is fit for the next patient, to ensure that no contamination happens during the operation. So when you give such convincing reasons, and when you're giving them the right reasons for the delay, they get the idea why it is happening. It becomes easier to control an agitated patient. But if you keep saying, I'm sorry, I understand, I apologize on their behalf, you're just repeating things that do not carry meaning anymore. Instead, say what the next step should be, state what is happening right now, and then give the reasons, the explanation for the delay. Okay, so I hope I've answered that question of yours. There was another question on dealing with children. It's very interesting when you talk to children. You can be very relaxed with your language. Okay, you can call them by their first name. You can call them dear. Now, in the foreign setting, you must have had or you must have seen movies, or you must have listened to conversations or watched video clips where the healthcare professional is very much shows a lot of affection towards a very small patient, like a child patient. So they might call the patient sweetheart, might call, you're doing good, darling, that's okay, my dear. So there are a lot of terms that you can use when talking to children. Okay, now these are all accepted usage when it comes to a Western setup. I'm sure we wouldn't be calling darling or sweetheart to total strangers. But when it comes to a Western setup, and when you're talking to a young child, a small child who's really suffering or who's in the hospital, and a nurse or a doctor is talking to the patient, they tend to use these words, which will comfort the patient to a different level. It gives a lot of comfort to the patient. Okay, so these are the kind of words you can use, and that does not mean you have to every time say darling. Okay, that depends on the concerns that you're addressing. If there are, and never underestimate the fears that a child has. The child might say, I don't want the operation, I might die soon. Okay, so do not laugh at it. Don't say, why do you think you will die soon? Okay, that's being very rude. But try to talk in such a way that you will convince the child. Okay, do not worry, dear, nothing like that is going to happen. Okay, so you're trying to convince the child. Now the child might just scream and shout that it's hurting me a lot, I'm going to die, what do I do? Can you give me some medicine for the pain? Okay, so there again you need to try and explain why a medicine might not be possible at the moment, or how the child has already been given a medicine and it might take some time for the medicine to start showing its effect. Yeah, so how the medicine will really change the child's condition, how it might take some time. And you need to try and like we had a discussion earlier, if it's a very very small child, then maybe you can connect it to things that the child really likes, a cartoon character, a superhero, the child is really fond of, and start connecting that conversation to that particular superhero or a cartoon character that the child loves. Okay, so that will also make it really effective to talk to a child patient. So like Lintu said, you need to gain the patient's trust. Okay, so that's exactly what you need to be careful about when talking to children. And again, layman, no difficult language, do not scare the child, think twice. If I use that word, will it really scare a child? And sometimes when you talk to children, they might be reluctant to answer. Now there is an OET roll card about bedwetting, and you're talking to a 10-year-old boy who has a bedwetting problem. And the card says that he is reluctant, he is not ready to speak about his bedwetting condition. A very shy, embarrassed patient, a child. How will you talk to that child? Will you say, "Hi Michael, I know you have a bedwetting problem. Can you tell me about it?" Is that a right method to talk to him? How many of you feel that is okay? As soon as the child comes, when I say, "Hi Michael, I know you have a bedwetting problem. Can you tell me about it?" Can you answer can you start your conversation with the child like that? Do you think it is correct? That's a question. How many of you feel that it is okay if I tell the child, "Can you explain to me about your bedwetting problem?" Is it okay? Well, I would say no, because the child is already, your patient is already embarrassed, your patient is already shy and not ready to talk about bedwetting. So if you ask a question, an open-ended question, where you're asking the child to explain about his bedwetting problem, he will not respond. Michael will not respond to you. Michael will stay quiet. So what do you do in the roll card? Michael is not talking. So will you stop your roll card? Will you keep asking him the same question? Well, I would say, in the first place, that's not a right way to ask him. Do not ask open-ended questions to embarrassed, shy patients where they have to talk a lot. Like explaining in detail about bedwetting is going to be a daunting task for the child. He is already embarrassed, scared, worried, shy, everything he's not supposed to feel. He's already in that condition. So if as a nurse you ask him to explain it, he will not be ready to explain it. So instead, you need to try and ask closed-ended questions where he can just probably respond with a yes or a no, or maybe another word like "I feel bad," "I feel great," "I've been trying." So short phrases. That's all what a child will say when he's really embarrassed and when he's really shy. Okay? So there is no point in asking a question which needs a lot of explanation or description. Instead of saying, "How often do you wet your bed?" Keep it simpler. Do you wet your bed every day? Now, every day is easier for the child to understand. So he might say yes. Now you need to gain the child's trust. You need to try and show the child that there is nothing wrong about him in wetting the bed. It could be medical conditions, it could be familial conditions, it could just be that he needs a little more time to control this. Okay, so you're trying to convince him, saying that there is nothing wrong with him, and children of his age, if it's a 10-year-old boy, there are children of his age who have similar problems. So there is nothing that he needs to worry about. So you need to convince him that. That's very important. Okay, and as much as possible, try not to keep using the word bedwetting, 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 because a child who is really shy and who's really feeling bad about what he's doing, he might just pick up that word bedwetting. He's very scared of it already. he might feel even more bad about it and will withdraw into his shell. He will not be able to open up and speak about it. Okay, so go slow. Do not ask him questions like, I need to ask you a set of questions, and ask him one by one. It'll be good if you can have a chat with him. Okay, you can say, Michael, I've heard you love orange juices. Now, how often do you drink orange juice? Do you have a glass of orange juice every night before going to bed? So instead of, making it a very casual talk so that you're getting information from him about his drinking habit, do not say, Michael, I want to talk to you about your drinking habit. Okay, so don't say that. Now, a child will not understand drinking habit. Michael, I want to talk to you about your drinking habit, and the child will be like, what is that? Instead, ask him, do you carry a bottle with you when you go to school? Okay. And when you come back from school, is the bottle always empty? Do you like juice or water more? So you're trying to get the information from him indirectly, not by asking him that I want to know about your drinking habits, I want to know about your eating habits. These are all wrong terms to be using to a child. Okay? Instead, keep it simpler. What do you have for breakfast? Okay? So you know the kind of food he has. Or you could ask him about, do you play around in the evening? What kind of games do you love to play? Do you read a book before going to bed? What is the activity you love doing before going to bed? So that you know what he is into. Probably he watches TV and he drinks a lot of soft drinks. Now directly if you ask him, do you have soft drinks a lot, Michael? He might say no. So if you just ask him, what do you do before going to bed? Do you watch TV or read a book? So if he say, then he'll start talking, saying, okay, because he's sure you're not talking about his bedwetting. So he'll say, oh yes, I love to watch TV at night. I watch a cartoon, and as I watch cartoon, I always drink a can of Pepsi. So indirectly, you've got the information you require that he uses soft drinks, which is not good, especially for a child who has a bedwetting problem. So I hope you've understood how you can deal with a child patient, a patient who's maybe very shy, a patient who's very reluctant to speak, a scared child. You need to win their trust. You need to keep the questions simple. You cannot use the language you would use to an adult. Okay? Avoid the subheadings like, I'm going to talk about your eating habit, let's talk about your drinking habit, let's talk about your exercise and diet, your school habits. Avoid such phrases and instead ask him, break it into small questions that he can understand and let him answer that. So he feels more comfortable talking to you, you win his trust, and he's actually also giving you information about all the information you require to help him with his bedwetting issue. Okay, so I hope I've answered the question regarding talking to a child patient. Okay, just to keep your interest levels high, we are soon coming up, this week itself, we'll come up with OET mock speaking sessions. Okay, and it'll be fun if you guys want to participate in the mock speaking sessions with us. We'll have live speaking sessions. So if you all are really interested in participating with MedCity in these live OET mock speaking sessions, please let us know in the comments so that we can contact you and we can also let you know when it is happening and how. Okay? Do let us know if any of you out there watching from the different parts of the world, if you are interested in being a part of our OET mock speaking. Okay? We'd like to have your participation in that as well. And those who are interested, please send me a comment so that we can work our plan accordingly. Okay. So now here there is another question that I have at hand. Okay, so let's say, okay, now if the patient says, or if the patient asks you a question which you are not really sure of, it could be a particular medicine, it could be the cost, it could be a phone number, it could be a side effect, it could be more details about a disease condition, it could be any other query that they have regarding a discharge, anything that as a nurse you will not be able to explain to the patient. In such a condition, how do you deal with the situation? Now the patient has asked you something. Can you give me a response? Can you tell me how you deal with the situation when a patient asks you something and you're not really sure of the answer? What would you do? Any responses to that? How would you respond if you're a nurse? They've been asking you something, the patient has asked you. Probably it's a medicine that you've just suggested. The doctor has asked you to convey or talk or explain about a medicine that the patient should use. And the patient has just asked you, how much does the medicine cost? And you're not sure of it. How do you deal with that situation? Anyone out there? Anyone, you've been in such a very sticky, tricky situation where you don't know what to do. How do you respond? Can you ignore the patient's question? Can you ignore the patient's question? Okay, now there is a comment that one of them somebody has put up a comment with an introduction to a previous scenario that we discussed regarding bedwetting. And they've asked, is that introduction fine? In most cases, yes, it should be fine. Okay. Any answers to the question? How will you deal a patient who has asked you something and you're not sure of the answer? What do you do? Can you act like you haven't heard of it and say, oh yeah, I have to talk about your discharge plans now? Can we do that? No. So how do we deal such a patient? The patient has just asked you the cost of a medicine and you don't know. Okay? So there are some options that one of our viewers, who goes by the name Lavender World. So Lavender World has asked if these kinds of phrases can be used. And the phrases are, I will confirm and let you know. I will inquire and let you know. I will discuss with my seniors and let you know. I think the doctor will be a better person to explain regarding this. Can we use such expressions? Well, it is all right to convey to the patient that you're not aware of it. So you can say, I'm sorry, I do not know the cost of the medicine right now, but I can fix an appointment with our pharmacist. Maybe you can have a word with him. Or you can say, I'll have a word with our pharmacist. I'll check about the cost and get back to you later. Good. You can give a leaflet or a brochure if they're asking more details about a medical condition, which probably you might not be able to explain. You can say, sure, I'll give you a leaflet, or you can say, I'll give you a brochure. which has details about the condition and how you can handle it. Okay, so many of them have put up comments saying leaflet, brochure. You guys are right. Or you can always say, I'll check with the doctor and let you know. Yes, well, I certainly, but I need to check with my doctor. Good. Good. Be honest and tell that you'll find out and get back to the patient later. But remember to get back to the patient later. If they ask for a phone number, can I have the phone number of the physiotherapist, please? You either give an imaginary number, which is okay. You can say, oh yes, I have the phone number of the physiotherapist in the file. Please note it down. And you can give an imaginary phone number, or you can say, I'm sorry, I do not have the physiotherapist's number with me right now, but in my evening round, when I come to check you again, I'll make sure I have it with me. Okay? So you need to respond to it. You need to give an answer. Exactly, Tintu, you can give brochures. Vinita, right, I'll get back to you later. But make sure you respond to the patient. Do not ignore the patient's concern at all. Okay? You might feel it is not important. Now, this is what OET speaking is about. You need to expect the unexpected. There might be a sudden unexpected question, and you should be prepared for it. Prepared to respond to it. Okay? And do not worry. If you deal that situation well, like the examples that most of you have given, I'm not sure of the exact cost. Good. Be honest. Sorry, I would ask my senior and let you know. Correct, Vinny Praveen. I'll check with my senior and let you know. Good. I've got wonderful responses as comments here. Right ways of dealing with the situation. Okay? So do not think if you say, I will get back to you later, I'll check and let you know later, you're going to lose marks in your OET. But maybe you might get good marks because of it, because that is how you should be dealing with such situations in a real life situation also. Correct? Now, as a trainer, as a mentor, as a teacher, I have faced similar situations in the past. When I started my teaching career, I've been teaching at different places, and I've had different kinds of students. Okay, I've had students from different nationality as well, and whenever I've always been honest with my students, and if there's a question they've asked me which I'm not sure of, I've always been honest. So I'll say I'm really not sure of it. I'll check it out. At the same time, you guys too try and find out. We'll discuss it tomorrow. And what I make sure is the next day I go to class, I make sure I discuss it. Okay? So there is nothing harm in accepting the fact that you're not aware of certain things. Make it clear and give them a response to that. That should be fine. Okay, there are some comments that I've missed out while I was explaining, and I've seen there are quite a few, questions regarding pregnancy, dealing with breastfeeding, dealing with the postpartum mother who's lost her baby in the delivery. So I find that many of you have questions probably regarding talking to a pregnant patient or a patient who's just delivered a baby. These are all sensitive topics. When you talk about breastfeeding, when you talk about engorgement, remember, as a nurse, there is nothing to feel shy. Not even on the day of your OET speaking. I mean, there's nothing wrong with a breast, and there's nothing wrong in discussing how to, breastfeed a baby. There is nothing wrong in listening to the concerns of a mother who has pain on her breasts, engorgement, which happens when, there's a lot of milk that is still there in the breast, which is not let out. Maybe the baby is not drinking enough. Maybe the mother is not really aware of the breastfeeding technique. Okay, So there is nothing wrong in explaining. I've noticed that certain students feel very shy when such topics come in their OET speaking. As medical health care practitioners, you should never be shy of talking out things like these to your patients or to their bystanders. And there is nothing wrong in talking and discussing these things with your friends as well. Okay? So, and probably you'll have to be more descriptive there. When you're telling them the breastfeeding position, you need to be descriptive there. Like, hold the baby like this. That does not make sense, right? Make sure you hold the baby, the head of the baby, on your left hand, and the rest of the body should be held using your right hand, and the baby's head should be facing your breast. So you're being more descriptive there. Okay, so that was a question I found regarding maybe breastfeeding and engorgement. If you're talking to a patient regarding that, you need to be open about it. You need to give the exact reasons, and you might also have to be a little more descriptive when you talk to a patient regarding these. Okay, and certain other questions coming up as well, which probably I might not be able to complete in this particular session. But it's been great talking to all of you. Like I said, we are planning of an OET speaking session, and we'd love you guys to participate in our speaking. If you're interested, do leave us a comment showing your interest to be a part or participate in our speaking session. And we'll keep you updated on when and how we will be having such a session soon. Okay, it's going to be fun because we've had the last 2 to 3 weeks, we've had sessions on speaking. There are different trainers who've taken sessions on speaking, and I know you're all eager to practice it and try out the different techniques, the different tips we've discussed. You've all got different skills of handling different situations. I know you would super love to try out that and see how well you succeed. Okay? So, if you're interested in anything like that, do send us a comment. We'll get back to you. Okay. So, Shaima Inku has asked, before I wind up, how do you deal with a corona positive patient? So, Shaima, a corona positive patient, okay, is like any of our other patients. So, how do you deal? Shouldn't be a problem. Whenever we talk to our patient, we are honest, we are realistic, but we are not negative. Okay, so that's what you can keep in mind even when you talk to a corona positive patient. You need to be informative here. You'll have to explain the condition. You'll have to be more descriptive to the patient here. Okay, so giving information will be required when dealing with a corona positive patient. The patient needs to know his condition, state of his condition, how it can be dealt with, and what he should be careful about. So a lot of information the nurse will have to give out to the patient. So make sure the information you give out is well structured. There should be a good order in which you're trying to talk to the patient about his condition of corona and what can be done to make him better. So Saima, I hope I've answered that question. If you have any other questions, queries, you can keep commenting. Even if this live stops in a short while, we'll be still looking at your comments, and we'll ensure, like I did today, in our coming sessions, we'll include those comments if it was not answered today. And I hope at the end of the session, the weather around your area has become much more pleasant, better, and I know you're all getting hungry by now because it's almost lunch time. Thank you for this wonderful session, and we'll be coming up this week again with a lot more sessions. So keep watching our Facebook page for details on when we have sessions and what sessions we have. Do not forget to download and use our MedCity app. And if you want to prepare much more vigorous way, you can enroll on our online OET course. And like the Nurses Day offer that we have starting from today, active from 11, 12 to 13th of this month. So we have 3 days where you can avail the online OET course. I hope you're all aware of the course that we have in store for you. It's going to be, if you take up the Super Prime pack for 4,000, you get 1-to-1 live classes. There's nothing more wonderful than that. Okay? So look up at our Facebook page for details regarding our Nurses Day special package. And let me wind up the session. By letting all of you out there, all the healthcare professionals there, frontline workers out there, to know how grateful we are and thankful, and we're really proud of the service that you're giving us. And we hope that we're making you feel much better by doing our part and staying at home. Thank you so much for all your efforts. See you tomorrow. Bye. Good afternoon. Have a lovely day ahead. Bye.